Hey babes, welcome back to the channel. I know this is kind of an awkward setup because I don't want to hold my camera the entire time, and so the only place I have is like a cabinet to put you guys in. So excuse me for this janky setup, but I just wanted to let you guys know how my rotation is going, where I'm going next because we did get our next placements, and just how I've been feeling overall about my rotations. I'm literally halfway through. This is rotation 4 out of 8. So if you want to see how my clinical year is going, my second year of PA school, just stay tuned. As you all know, I'm in emergency medicine right now. I'm just so happy. Honestly, one of the biggest pros of this specialty right now is that it's not over an hour away from my house. Before this, I was in behavioral health, and that drive was like over an hour. And so I was so annoyed by that every day, sitting in traffic. They did let us leave early to try to beat the traffic, but sometimes we did it and I would be sitting in traffic for a while. So kudos that this rotation is like 30 minutes away from my house. Now, the first day I was late, but it's because I got there on time. So my shift starts at 6 p.m. I got there at like 5:45. I didn't really know where to park, so it was taking me a while. And then I went to the badge office because my school is supposed to set up the badge and everything for me. So I went there, and lo and behold, my school hadn't set it up for me. So I was going back and forth with them like, hey, I signed this paperwork. I sent in this image. Like, my badge should be here. I start today. I started at 6 and it's currently 5:55. So the guy ended up making me a new badge, and so it made me late going to see my preceptor. So I got there at like 6:10, 6:15, because of course I didn't even know where he sat in the hospital. So yeah, first day, not my best impression. He literally saw me and was like, yeah, just make sure that doesn't happen again. And so now I leave work, I kid you not, like over an hour early, just to make sure if there's traffic, if I get lost, if anything, I am at work on time, because I know now that he does not play about being punctual. But yeah, speaking of my preceptor, he's a super nice guy. He actually gave a PowerPoint presentation at my school about emergency medicine, and so of course him being my emergency medicine preceptor is definitely worked out in my favor, because now everything he said in the PowerPoint, I see him doing it in real life, and I just can now understand the process of what emergency medicine is and how important critical care is. I'm also there with another student, but it's not another student from my program, it's from another program in the area. She's super nice, the girl I'm on it with right now, and she does have an interest in emergency medicine, so really putting her best foot forward, because he does hire PA students. Like, if you do really well in the rotation, he may offer you a job. I don't know. I like the hospital, I like my preceptor, but I want to get into more of how I'm feeling about the rotation. So needless to say, for me, I knew going into this I wasn't gonna be on my highest game. Like, I'm not an emergency medicine person. I don't really like to think the worst in people. I feel like it's a personality thing with me. Like, I don't like to assume the worst in people. I don't like to give bad news. I don't like to see people when they're super upset or super not happy. I don't know if it's because I'm so empathetic that I don't like to be around people in such critical moments, because then it makes me feel a certain way. And then it makes me super nervous and super anxious, and then sometimes I can't get my thoughts together and I can't process what's going on quick enough. So I think that's the first thing. Like, for me, emergency medicine does not fit my personality. I was talking to the other student there last night, and I'm like, yes, I'm very much so a clinic person. Like, I like building relationships. I like going to work Monday through Friday. I honestly don't like hospitals either. I don't know, it's because like most of my family members who've gone to the hospital have passed away. So it's something about entering the hospital that just always puts me on edge. So yeah, I don't like the environment per se. I'm not a emergency medicine person, and I knew that going in. But I still have heard really great things about this rotation, so I wanted to put my best foot forward and just take emergency medicine for what it is. My preceptor seems to really love what he does, and I haven't gotten a chance to talk to other doctors on shift with him at night because we're so busy, and he's the only PA, so I can't ask, at least at night, so I can't ask the other PAs that work there, like, oh, how do you feel about this, like, or how much do you like your job? But I can tell he really enjoys what he does, and he definitely makes moments to teach. He's a big teacher. He does a lot of pimping. If you're in the medical world, you know, med student, PA student, you know what pimping is when he asks or she asks you a bunch of questions, like after you see a patient. So what he'll let me do, because last night we saw so many women's health cases, and I told him that's where my interest is right now. He allowed me to go in and be the primary provider for those patients. So I went in, I asked all the health and physical questions. Then when I came out, it was immediately, what do you think is going on with the patient? What do you want to do with the patient? Any imaging, any lab work? How do you want to treat the problem, if it's this or this? And then he's also big on like antibiotics, so knowing if it covers gram-positive or gram-negative, and then knowing some common causes of like infection. So last night, one of the ladies we saw, we thought had a UTI, and so he was like, okay, what's the most common bacteria, and then is that bacteria gram-negative or gram-positive? So he asked a lot of questions like that throughout the shift. And of course you see so many conditions, so you may get a chest pain one moment, a shorter breathness, a UTI, a vaginal bleeding, and so you have to know differentials for all those diagnoses, plans for all those diagnoses, and then sometimes antibiotic usage and why did you do this test and not others. So sometimes with all those questions, I do get overwhelmed. Like I said in the beginning, I'm not a person who likes to feel pressured or feel anxious about delivering care, because then I know I'm not going to do it to the best of my abilities. If you guys could see me on this rotation, sometimes I'm literally just floundering in my opinion throughout the night, because he's asking me so many questions, and sometimes I get them right, but oftentimes I feel like I get them wrong. But he's really good at teaching. So after that moment where he's like, okay, I've asked and she doesn't understand, he then sits me down. We have a conversation about it. Also, I write all of his notes. Not all of his notes, but if I see a patient and I've had a good enough history and physical for them, I'll go ahead and write the note for it. And then at night we'll go over it, and he'll tweak it and change it, and tell me what's good, what's bad, what I want to include inside the note and things like that. So he's very helpful, but I think I'm putting a sense of pressure on myself to like do well at this, because nobody wants to go through a whole 5 weeks of a rotation and never feeling like they got their footing. But I do feel like it's helping me understand that I was right in the fact that I don't like emergency medicine like that. So yeah, that's just how the rotation has been thus far. Right now I am about 2 weeks in, but with emergency medicine, you don't work every day. So this week has been a lot of shifts. Like tonight is my last set of 3, and then we get 2 days off, and then I work this weekend, so Friday, Saturday, Sunday, and then basically all next week I'm off because it's my husband's birthday. So he's coming to visit me, and I just wanted to spend as much time with him as possible. And then my school allows you to take 2 days off during any of your rotations, so I was like, yeah, for his birthday I'm definitely taking an extra 2 days off to make sure I can spend the most time with him as possible. So yeah, hubby's coming into town, and then after that I think I'll have 2 more weeks, and then I'll take my exam and do my end of rotation stuff like I always do. But honestly, I haven't had a lot of time to study for the exam, and when I tell you the topic list, I'm going to insert it here. It is huge. It is so much stuff. And then like I mentioned before, he works nights, so I work 6 p.m. to 4 a.m. Oftentimes I'm waking up at like 11 p.m., 12 p.m. And at that point, I'm literally like hopping in the shower, brushing my teeth, washing my face, and preparing to go to work again. Because like I said, I go to work like over an hour early to make sure I'm not late for work because of that bad experience the first day. That's how the rotation is going thus far. Like I said, I'm like 2 weeks into it right now. I only got 3 more weeks left. And then honestly, he lets you leave like, so that last week I may not even have to work at all. So I may have like 2 more weeks left of this rotation. So I'm happy it's like flying by, but it's also like every time I go in, I was talking to the other student about this, and she was saying how she has like some pre-shift panic. And I feel like, yes, every time I'm like preparing myself to go to work and like get in my car and like get to the hospital, walking into the door is just like, I get so nervous because it's like, yes, tonight is going to bring me so many different complaints, and he doesn't allow you to just sit there and do nothing. So it's going to be so many different complaints. I'm going to have to remember so many questions. He's going to ask me so many things that I may not feel comfortable answering. So it's just like, yeah, every shift I'm kind of like a ball of nerves. And then as the shift goes on, as we get closer to 4 a.m., because we get off at 4 a.m., I'm just like, okay, another day done, another day in the books. I'm literally just trying to get through this rotation. But like I said in the beginning, we have gotten our placements for our 5th rotations, right? For our 5th rotations. And so my next rotation, I want to give a drum roll to it. And then I'll preface it by saying, I say this all the time. I love kids. I want kids. But kids in medicine are just not my thing. I don't want to get sick from their little germy fingers and their sneezing and their boogers everywhere. Also, parents can be a little bit overbearing, and I'm telling you what your child needs, and you always feel like you know better than the doctor or the PA, and it's just like, so I don't like children in medicine. But guess what my next rotation is? Pediatrics. So I was really hoping to have my elective next. Like, since we're getting down to the wire with my rotations, like I said, we have 8. I'm currently on rotation number 4. So, you know, the next one will be 5 and I will have 3 left. So I've been trying to piece together, okay, what do my last 4 rotations look like? And for some reason, I knew I hadn't done pediatrics, but I didn't think it would be next. Honestly, I thought I would have my elective next. So I was excited about it because I was like, yes, because with your elective, you don't have to take end of rotation exam. So I was like, yes, I'm so tired of taking all these exams because at this point, I'm going to have to take 4 back to back. And now that I know I'm in pediatrics, that's 5 exams back to back to back. And this emergency medicine one is huge. So I'm just praying I do not fail it because I haven't had the time to study. But yeah, so my next one is pediatrics. And it's a outpatient clinic because we do have a pediatrics emergency medicine rotation, but I think that when you have to specially choose it or something like that, so I wasn't going to choose that one or waste my request on it because you only get 2 requests throughout clinical year, and one of them is basically to select your elective and the others for anything else. And I didn't want to do peds that much, so I wasn't going to specialize to do peds EM. But yes, so I'm doing outpatient peds. From what I've seen, like in previous classes, they always leave us feedback, and they were saying how the doctor there is big on letting you check the history. He doesn't really let you do the physicals, which I would like to see it because, of course, doing a physical on a 10-month-old baby is different than doing it on adults. And so far, all of my rotations have been adults, so I do want to see the difference there. I feel like with all my rotations, I try to get excited in the beginning. Like, I try to make myself excited to do it. And then once it gets presented to me and I see like, oh, actually, I don't like this, or, oh, actually, this is fun, or like, oh, I'm kind of indifferent to this one, it makes it better. But before then, I always try to hype myself up because if you don't go in with an open mind, you're going to already set yourself up to fail. So I don't like to do that. But of course, as it progresses, I'm like, okay, either I'm failing or I'm passing, in my opinion. Overall, clinical year has been really fun. It's given me a lot more time to do my hobbies. Like, I can go to the gym more. Not this rotation specifically, because working overnights has really drained me. My body still hasn't gotten used to it. Last night, we had to stay a little bit later too. So we stayed till like 4, like past 4. So today I didn't even wake up till like 1 p.m. So imagine me like waking up at 1 p.m. trying to study, trying to do things for school because they give us so many outside assignments, and like just trying to stay afloat on the rotation. So sometimes I even come home and like study conditions just to make sure if they come up again, I don't not know the answer. So it's just like, it's so much. I don't have the time and I'm not well rested. And I also feel like I'm getting sick. So every night since like the first week, I've been wearing a mask to work. As I was saying, like so far clinical year though has given me a lot more time to like work out, to talk to my friends, because one thing in didactic is like, I feel like I was in such fight or flight mode. I didn't really branch out and talk to more people. Even the people that sat next to me in class, like the only person I really talked to was Kendall, and you guys have met her. I think I've been using this time to really get more involved with my class and like do things that are fun with them. And you know, that week that we go back, I try to talk to anybody who wants to talk to me. Of course, I'm not going to force it, but if you want to have a conversation, I'm definitely down to do that. You want to ask me how my rotation was, you know, or you had one of the ones I'm going to. Like, I just feel better conversing with people this year. I also feel like I built my confidence. Though this rotation is not something I feel like I'm well suited for, I do have less nerves when I go in and talk to a patient, explain their treatment plan, when I'm doing the physical exam. And like I said, he's a great teacher. So if I do feel like, okay, I don't know if I can quite handle this case, he's totally fine taking it over. Because last night I had a case, it was a 23-year-old girl, but she was very sick. She had a stroke. She had 2 heart stents. She came in because she was having chest pain and shortness of breath. She was also kind of visually impaired. So she just had a lot going on. So even though he wanted me to assess her, he saw pretty quickly that she was a very complicated case, and the medicine wasn't working, and she wanted higher pain medication. But of course, he wants to figure out why you're having chest pain in the first place. Her EKG was fine. So it was just a lot going on. So he was like, you know what? She's a complicated case. So he took that one over for sure. But I did start asking her questions and start getting history, but it was just too much, girl. So yeah, I do feel like I've gotten more confident. I'm still working on presenting patients to my preceptor. If you guys are in medicine, you know, once you see a patient, if they've let you be the primary provider, so you go in the room by yourself, you ask all the questions, and you report back what the patient is going through. With him, I find it hard to present the patient because none of my previous rotations really had me presenting except for behavioral health. And with that, you go through a huge history. Like, I go through all the questions I asked in a day. I go through any past medical history. I go through stuff from like when you were born, do you have a job? Do you have health services, you know, social services, like you've been to jail, like do you use drugs, how often, what drug. So we go into so much detail that's what I've been used to when it comes to presenting a patient. And so when it comes to him, he's like, what is the patient here for? And then what treatment do they want? Because sometimes patients come in just like, oh, I got sent here by my doctor, they told me to get this. Okay, so you're just expecting IV antibiotics, but I need to make sure your history and your physical exam means or signals to me, oh, this patient needs antibiotics. So yeah, he's really like straight to the point. Why are they coming in? What do they want? Have they seen anyone? Have they tried any things? Also, some big questions that he always wants me to ask are like, are they immunocompromised? Who are their doctors? Current medications that you're taking every day, because as we know, medications can also have side effects that can sometimes put you in the hospital. So yeah, I feel like my rotations have definitely made me more confident as a provider. I remember my first, like during didactic year, when I was a patient or a mock patient for the 3rd years, I was so like, oh my God, I will never in a million years get to a place where I feel so confident going through a full physical exam, going through a history, knowing the treatment plan and counseling a patient. Like, I never thought I would get to that point, but honestly, I'm getting there. I think my behavioral health CSC, it went super well. And even the student that was my mock patient afterwards, she told me, she's like, wow, you felt like a real PA. You were extremely thorough. And she was like, you're doing good. And I was like, wow. That made me feel so good inside, because it's like, I never thought I would have the confidence to do this. Like, even when I first got into school, I'm saying, I don't ever think I would have the confidence to do this. And so now it lets me see, like, after these 2 years, you know, 1 year of training and a year of being in clinic, I can do this. Like, of course I'm nervous. Of course, you know, it's my first job where I'm primary provider for anybody and I'm not reporting to anyone. But I'm sure I'm going to have great mentors. I'm sure my first job is going to be one who sets me up for success, and they have an extensive training period, and I don't feel like I'm just led astray and left out there to fend for myself. But definitely clinical year will make you feel more confident in yourself as a provider, I think. And something I've realized about myself, you know, in clinical year is that I like algorithms. I really do. But a large part of medicine is being able to ad lib, because we've had patients in the emergency room so far who have the exact same symptoms, but we work them up completely different because there's something different. So you have to be able to ad lib and not just say, oh, well, this is similar to that one, so we work it up the same way. That's not true. Like, we had one guy who came in with gastroenteritis, and we had another girl who came in with appendicitis. So both abdominal pain, both nausea, vomiting. I can't remember about diarrhea or constipation. Of course, we did an abdominal exam. One person was specifically pointed right lower quadrant, and then the other person had pain in the upper quadrants of his abdomen. And so as we were pressing on it, and the pain was radiating into the back, so of course we thought pancreatitis too. So we did amylase and lipase to see if the patient had any increase in those enzymes, but that was not it. So we kind of came to a conclusion it must be gastroenteritis, because he did have, I think he said like some crazy food he was eating or something like that. And it was acute too, so it's not a chronic condition. But her appendicitis also started acutely. She had nausea, she had vomiting, but her pain was pointed to the right lower quadrant. She did have some pain on inspiration, like when you press into the right upper quadrant. So we thought, oh, maybe she has a gallstone. But no, we did a right upper quadrant ultrasound and there was no gallstones in sight. So yeah, worked up for appendicitis. She had a CT scan done, and I think it did show some appendix abnormalities. But anywho, I said all that to say, you have to be able to ad lib in medicine. There's no blanket way to treat each patient, and that's something I'm really learning since being in clinic. Because I feel like before, when teachers are teaching you about patients, things can seem very cookie cutter, like, oh, this is how it's going to present in real life, and oh, these are the only symptoms I need to look out for. But no, women can present atypically for some symptoms. You know, men can be predominantly known to have certain conditions, but women can also have them, so they always have to be in the back of your mind. So I think that's something also clinical year has taught me. You have to be able to ad-lib and not just assume because they're presenting the same, it's the same thing. But I just wanted to make a quick video because I know so far I haven't been able to record like day in the life on my emergency medicine rotation or anything like that, because for one, I'm not gonna bring my camera to the hospital, and for two, it's just like I don't wake up till 2 p.m. and so I had to go to work today, so it's just not gonna happen. But I did want to make this video and just let you guys know how it's going. Also notice my last video is getting a lot of views, so I'm like, you know, I feel like people are missing me on YouTube. I hope I'm right about that. So I just wanted to make a video letting you guys know how things are going. And then my next video will definitely be another sit down video. I want to talk about my goals for this year. I'm going to share some goals also that my husband said it was okay to share. So I just want you guys to know what is happening with me, what's happening with my channel, what things I want to accomplish in 2025. So that's why I'm going to sit down and make that video. But so far, thank you guys for watching to the end of this video. I hope that it helps you. I hope it inspires you. Even if you go on a rotation, if you're a medical student, PA student, nursing student, even if you go on a rotation that you know is not for you, still put your best foot forward. Still go in every day optimistic that you'll have a good day, because if you don't, you set yourself up for failure. Okay guys, so like I said, stay tuned for the next video. Thank you so much for watching, and until next time, bye babes.